The fountain of youth, you may be sitting on it. The fat from various parts of your body could be used to give you a younger-looking face. Here's Global's health specialist, Linda Boyle.
She's a youthful 40, but even so, Debbie Marshall worries about time leaving its mark.
And right in here, the little frown lines, which are...
She's decided to do something about it.
More of a youthful look, just to kind of give me a little bit more fullness in my face. And as far as a facelift, scares the heck out of me.
She's about to try something completely different.
I am taking fat from my own body, which makes me feel very comfortable. I'm not putting something foreign into my lips or my skin.
Call it fat recycling, taking a little from the buttocks, abdomen, or thighs and injecting it into the face. Plumping up a face can make you look younger because as we age, our faces literally shrink.
It almost collapses, almost like air out of a balloon. And what was full-cheeked and full eyes becomes hollowed eyes and very gaunt cheeks.
Putting a little unwanted fat to good use isn't a new idea, but in the past it never really worked very well. And that's because fat is fragile. Removing it, then re-injecting it, damaged it. New surgical techniques mean fat is back in cosmetic surgery.
And we just got to get the fat out of there and get it up into your face, okay?
Gone is the old sharp suction method of removing fat. Instead, plastic surgeons use a transplant needle that's blunt-tipped and allows fat to be removed intact. For Debbie, this is painful. A personal trainer, she's more muscle than fat, and removing fat from her buttocks is difficult. After it's removed, the fat is purified.
We spin it down, take away all the contaminating elements.
Fat is then layered into her cheeks, brow, and lips. It will take 3 weeks for the swelling to subside. After laser surgery to smooth lines around her eyes, the transformation is complete. And Debbie says it was worth it.
Everything turned out just the way I wanted it to. You know, I'm very pleased with it. All the changes are subtle.
How long will the new look last?
Over a few years, the fat will tend to shrink, or the elements of your face will droop over the fat, and you may need to have it done.
But for an increasing number of women, the body's own fat reserves are a newly discovered fountain of youth. Linda Boyle, Global News, Toronto.
So you think Bill Gates owns some impressive real estate?
Coming to you from Queen and John, it's Cityline with Marilyn Dennis.
Show. It's our Looking Good special. We got 3 experts. We sure do. We've got Dr. Steve Mulholland here. Let's hear from Steve, cosmetic surgeon. And we're ready to roll. The first take. Heather Muir had a dent in her forehead. I'm not kidding you. It's something that gets deeper and deeper the older she gets. So she went to see Dr. Steve Mulholland to see what could be done about it. Watch this.
Heather, how long have you had the dent for?
I've had the dent since my early 20s, and I just noticed it forming then, but it's gotten deeper and deeper and deeper, and now I just can't stand it.
So, Dr. Mulholland, what do you see?
I see a young lady who, in her very early 20s, really didn't have much of a dent at all. But she had a hereditary predisposition. Her parents had deep, deep furrows in their forehead, and even in her early 20s, you see a mild line forming where you wouldn't normally. Once we got to her early 30s, she started to have a very, very noticeable crevice from overactive frown lines. Again, a hereditary predisposition. Her parents had it, she got it, doubly bad. Now we have a young lady who in her mid-30s, even when she's not frowning, has a permanent indentation, almost to the point where when you look at it, it almost looks like a scar or a bit of a deformity. Because she's been frowning so long, she's left a change in the collagen of her skin, an indentation.
So what are you going to do about it?
Our plan is to, first of all, put those frown muscles to sleep, to use a little bit of Botox, a little paralyzing substance injected only into the muscles of the frown, so she can't do that anymore. But even when we do that, we won't have corrected her indentation. So we're going to take substances from her own body, some fat, lay some fat in the base of that deep furrow to soften it, and then take a little bit of injectable filler, some Hyliform or some Articol, to give her as smooth a possible result. And that is what I would anticipate she should be able to see at the end of our procedure.
Dr. Mulholland, now it's the Botox.
Yes, I've wiped her skin clean with alcohol, and we're going to put the Botox into her very active frown lines. Heather, give me a good frown. Very active muscles. I'm going to insert little Botox on either side of her frown line, and that will go into the muscle and put it to sleep. Now, Heather, it takes a few days for this Botox to take effect, 3 to 5 days. During this period of time, I don't want you to rub your forehead, and I want you to try and avoid excessive exercise where you get a lot of pressure, back pressure. So no straining, no lifting, no physical exercise for about 2 or 3 days. I'm going to hold a little pressure there now to minimize any risk of bruising. And we're going to do the other side.
Ah, you should have heard the camera crew going, ow. Everybody has different pain thresholds, sir.
Well, interesting, your camera crew's all male, but I didn't hear every women go, ow.
Yeah, they're going like this, and we were like this in the audience. And you guys are just, you know, Oliver, come on, you guys. Okay, let's talk about genes. This dent in her forehead is hereditary. It plays a big role in the fact that she has it, but the fact that something can be done is terrific.
Yeah, interestingly, there are pictures of Heather's parents, and we were kind not to show them today, but they had big, deep grooves in their early 30s as well. Yeah. And unfortunately, we can blame or fortunately, blame our parents for the ravages of age. When you look at the gruesome consequences of growing old, usually you can look at your mother,
it's gruesome
the mother's
sometimes.
Mother, your father, and you can see those jowls, those cheeks, those eyelids that they've passed on to you.
Or the nose.
Or the nose.
Or the nose, because is it true that the nose and the ears keep growing?
They do mature somewhat in terms of width, but their overall length and proportion is generally fixed by about 18 to 20 years old.
About 18 to 20 years old.
But the skin on top of it can change. So you get sometimes the W.C. Fields nose later in life, and sometimes the ear gets more cauliflower.
So when someone is not happy with what they have, do you recommend that they bring pictures in from their parents as well as you know, pictures from their youth, just to see how much it's accentuated?
To some extent, I always use the patient's own pictures from when they were 25, 35, and 45 to try and create a beautiful version of themselves.
Okay.
Because after surgery, the last thing you want is someone to say, wow, you look different. Who did your facelift? You want someone to say, you look great, you look refreshed, you look rested.
Did you do something with your hair?
Yes, I did personally.
No, you did. But that's what people do, just something with your hair.
Yeah, and if you can attribute it to that, that's wonderful. And usually that's what should happen. And then if you bring in pictures of the parents, you can show them that that's who to blame right there. You know, we can't trade our parents in. Unfortunately, the damage is done. And it happened at the time of conception.
No, we love parents. We love parents. And I know I'm going to hand my son down a couple of things. You can't see it right now because I've had them all changed. But he will inherit some of those things. But the point is, that's the kind of research that you do. Things are hereditary. You have to accept that. But what's remarkable is things can be modified, which is terrific.
Yeah, and especially, for example, the segment today with Heather. If we can, it used to be 5 years ago, we would jump right into surgery.
Yes.
Now, generally, I talk about a step ladder, and the first 4 or 5 rungs on that step ladder have no knives involved, which appeals to many patients, because
that is interesting.
You know, very few people in Canada are going to have a facelift.
Right.
But everyone wants beautiful skin.
Yeah.
Everyone wants to have beautiful skin.
Okay, well, here we go. Here's Steve at work on Heather's surgery. We want you to watch this, but not the cameraman. You'll get queasy.
And it's time for your surgery. Are you nervous, excited?
I'm both. I am nervous. I had a little bit of trouble sleeping last night, but now I'm excited now that I'm here.
So how does it look so far?
Okay, well, since the Botox, I love being on camera with no makeup. Since the Botox, it looks a lot better, so I'm really looking forward to seeing what he can do with the article. Yeah.
All right. Dr. Mulholland, what are we looking at here?
What we're looking at, Patrick, is the beginning of some purified fat. The first step today, we're going to take some fat from the patient's thigh, an area where she doesn't want it and doesn't need it. We're going to purify that fat, and we're going to inject it under the depths of her forehead furrow. We're going to add a little bit of articol to give her a nice, smooth appearance. And we put a little freezing in so she doesn't feel this, and we move back and forth, and the fat gradually accumulates in the syringe. What you're looking at is the creation of the purified fat cell. And if you look at this, there is no more blood, there is no more serum, just thousands and thousands of little fat cells. In this purified form, when we inject it with gentle microfat techniques, we can get those little fat cells to live with great predictability, and that's why this will likely last this young lady for years. Now the articol. This, Patrick, is the articol. This is the second injectable substance we are going to put in. this patient's furrow. I do this very, very superficially, inside the superficial depths of the skin, to add a little bit of steam pressing or a little bit of smoothing on top of where the fat went. And now we'll lay down some fat right there. Some article on top of the fat right there. You have no wrinkle anymore. Completely smooth.
It's our Looking Good special. Dr. Steve Mulholland is right here, and now it's time to see the result. Here's how Heather looks after it's all done.
So where are we now, Dr. Mulholland?
Well, as you can see, Patrick, Heather's had a wonderful result. She's completed her microfat, her articol, and the photofacials. And as you can see, she's had an astounding, well over 90% improvement in her rather deep frown line.
So what does she need to do to maintain this?
What I'd recommend at this point is about 3 times a year, every 4 months, Heather would come in for some Botox. The Botox would put to sleep that tendency to want to crunch the skin, and that should preserve this nice, smooth result she's got. Perhaps some good medical skincare products and some photofacials to continue to enhance and improve upon this already lovely skin that she's displaying. And as you can see, she's cut her hair, and she's for the first time showed off her forehead rather than hid it.
What do you think?
I love it. I love it. It's the best thing I've ever done for myself. I feel so good when I look in the mirror. It's a massive, massive difference.
Sure. Okay. We're gonna put Heather's phone number up, so if you're not doing anything Saturday night. How do you feel?
I feel great. I feel great. I used to, whenever I looked in the mirror, it was the first thing I would focus on, is my dent. And whenever I got pictures back, I would just look at my dent.
Yeah.
And now, I feel great.
See, the funny thing is, you and I worked on the foster parent special together a couple of years ago for Foster Parents Canada, and I'd never really talked to Heather that much before. And happy, but with that, you had like this furrowed brow kind of.
It's true, and what people are saying to me now is, you just look more relaxed. Are you, what are you doing? You look stress-free, you're more relaxed.
Yeah, and that was his point, right? That you,
exactly.
You don't know what it is.
Exactly, right.
Well, so did you like the fact that when you first started, you said, I can't work out for a couple of days? That kind of gives you an excuse not to work out. Yeah, I got to rest. I can't work out for a couple of days.
I'm just going to have to recline.
That's right. That's right. Well, listen, I think you look fantastic.
Thank you. Thank you.
It suits your personality. Okay, so I want to talk a little bit about maintenance, and one of the words, and we're going to talk about it a week from Friday because you're on for the full hour. Can you guys give me the date from a week from Friday, just in case I, make it on the 26th? He's here, July 26th for the full hour. That's Dr. Steve Mulholland. Just quickly, because we'll talk about it more on the 26th. Photo facials. You said that was part of her maintenance. What does that mean?
Photofacial is taking light, gentle pulsed light,
right,
and radio frequency waves and passing them through the skin so that we don't create any downtime. It's easy to take some lasers and give you a lot of weeping and crusting and oozing, but the photofacial is designed to be done about every 3 weeks. You do 4 or 5 sessions, and you really can turn back the clock on your
So what is it? It just takes, repairs any of inconsistencies in the skin?
It repairs
like
broken capillaries, veins, age spots, sunspots, pores, and we do it for the whole face or the décolletage of the chest or the hands, and it really just turns back the time on your skin. And it's one of those first 3 or 4 stepladder rungs that you can grab onto while trying to look your best without jumping into an operative experience.
And how often would you have a photofacial? Because you're glowing, Heather. That's always good to do, isn't it? It's good to glow. No, she looks great.
She is a glower.
She is a glower. Well, it comes from within. I know that.
Right.
But
we're working on internal photofacials too, but that's usually the psychologist.
Yeah, I give some gift certificates to some people I know. But just taking what you have on the skin, the imperfections on the skin, is it once a month?
Once a month, yeah. About once a month you come in, and the treatment's performed. Takes about 30 to 40 minutes, and you go back to work.
Okay, very good. All right. Well, listen, again, well done. Thanks for letting us follow you, because we're nosy people here at Cityline. Yeah.
A little intrusive, just a little.
Yeah, we're always in your face. Sarah is on the phone, and you have a question for Dr. Steve. Go ahead.
I do. I have bumpy, raised scars on my upper back and my front, and that's from, I guess, adult acne.
Okay.
Or when I was like 21, 22.
Yeah.
Is there anything I can do to reduce them or bring them down? And would it be expensive? Like what sort of cost would that
We
entail?
do like a ballpark. Let's see if we can do a ballpark figure.
Well, Sarah, you're suffering from a very common phenomenon, either on the body, like the back, and a lot of males have that, or on the face. It's the ongoing ravages of acne, which are scars and usually discoloration. The first thing is get the acne under control. See your family doctor. If you've been on topicals and oral medications, try that. There's
yeah, that's all gone, actually.
Okay. Some patients out there don't. They should try that or get on something called a clear light, which passes light through your skin and kills the bacteria that lead to acne, and then you don't need to get into some of the Accutane type medications. So once it's controlled, you're left with scars and discoloration.
Right.
Treatments like the photofacial will blend any redness that's residual, and if you have great big craters that create an irregularity, then you might be looking at some fillers to plump up the base of the crater. And the next step would be something a little more invasive, like resurfacing of the skin. But usually for those first 2 or 3 rungs on the ladder, you can get about a 30 to 50% improvement, and you'll probably be looking at anywhere between $500 and $3,000 to, depending on how wide an area is involved, to get that improvement.
Oh, that's great.
Thanks for your call, Sarah. Well, Dr. C is going to stay with us, and Derek Selby's going to join us. We're going to talk about complexion when we return. Stay with us.